Patients with seemingly localized kidney cancer currently have surgery as the standard of care. However, after surgery, about up to a third of these patients will recur, and their fate then is that of patients with metastatic disease. In order to potentially decrease the rate of recurrences, the PROSPER RCC study aims to look at overall survival of patients who've had exposure to nivolumab around the time of surgery.
PROSPER RCC is one of the most unique trials that is out there now for patients with kidney cancer. So there have been a lot of adjuvant studies lately given the emergence of immune checkpoint inhibitors for renal cell cancer that is high risk. This study takes a unique approach in sort of looking at giving a dose of the immune checkpoint inhibitor before surgery when the tumor is in place and all of the immune cells sort of have the close interaction with this agent such that you stimulate the response because the tumor is in place. Once surgery is done, we give the nivolumab after and we evaluate for overall survival.
I think it's a really important trial for our patients. And one of the nice features, I believe, is that it really is randomized. The randomization is either to standard of care, which would be immediate nephrectomy, or neoadjuvant adjuvant nivolumab, which really in a unique setting gives patients the best chance, I believe, at beating this disease long term.
For this trial, patients need to have a larger tumor, so greater than or equal to T2 clinical stage. Patients are allowed to have nodal involvement, and they're also even allowed to have 3 sites of metastasis, as long as these metastases are going to be definitively treated or resected within 12 weeks of surgery.
PROSPER is designed to be as streamlined as possible for the urologist. We do mandate a biopsy for all patients who are randomized to treatment. That biopsy can be performed easily in your office or by your ancillary staff. The nephrectomy still should be performed by the primary urologist who sees that patient, and we advocate for that. We want this to be as easy for our patients and as easy for our enrolling surgeons as possible. The trial is designed specifically so that there is not a lengthy delay for this process. For most patients, this is a biopsy followed by 1 week of therapy, and the following week they're in the operating room. In a streamlined system, this could take as few as 2 or 3 weeks. We've seen it take as long as potentially 4 weeks, but for most patients, these tumors have been present for months, if not years. And a delay of a week or 2 to get a potentially life-saving drug, we think is really important. And one of the things I reassure all my patients about is that we are not delaying surgery. They are getting therapy, and we're giving them a therapy we know is effective against their cancer. So in a sense, their surgery may be pushed down the road, but they're really getting treatment, sometimes even sooner than they would in the primary setting.
Our site has been successful in accruing patients for PROSPER RCC because we've been able to look ahead at our schedules and identify patients before they come through the door, working very closely with our medical oncologists so that we can streamline the process of enrollment and randomization.
PROSPER is a part of the National Clinical Trials Network, and so it is available throughout the country. Many sites are open at academic sites. There are local community affiliates that have the studies open. So again, regionally, we probably have the map covered for you to have your patients participate.
Although patients who enter PROSPER RCC ultimately have to be enrolled at an approved site where the study is open, what's nice about the study is really a urologist anywhere can perform the surgery. Thus, if I'm a urologist in practice, I can perform the surgery and still have my patient participate in PROSPER RCC as long as they register and enroll at an approved site. The ECOG-ACRIN team, along with all the investigators, are extremely excited and motivated to help you enroll your patient in the study. By emailing the ECOG-ACRIN team or contacting any of the principal investigators or sites, you can enroll your patient in the study.
So I think physicians should consider the study for their patients because I think research really, clinical research is the best care. We're trying to figure out so that the next patient sitting in front of us, when they ask the question about what do I do because it's high risk, we'll be able to answer that question for them.